Hi, this is my video on doing a vaginal exam. So my client, this is my client that she's in labor. I was not the backup, so she knows who I am. I've labor has been going for a while, and we would just like to know how it has progressed. She is a first time mom, and she's kind of feeling like maybe she might have that urge to push, and so we have talked about the benefits and risks of doing a vaginal exam, and she has given her consent to do one. And so I laid down a checks pad, which I mean I didn't this time, but I normally lay down a checks pad with a live client, and then I give her a sheet if she wants to, but most of the time during labor, then the clients don't want a sheet. They want just everything to be off of them. And then I actually like to use some olive oil, and so I'll, with a non-sterile glove, then I'll use some warmed extra virgin olive oil, and I'll just rub that around the outside and the perineum. And then I wash my hands completely, and then I put on a non-sterile glove. And then I make sure that my client's feet are together, like this, heels together, and then have them spread their legs out like a butterfly. And then I always do it from their right side, because that is just the most comfortable for me, and because I'm right-handed. And so then, sorry, I have to hold my phone because it just wasn't working to be on the floor. So then I let my client know, okay, I'm going to touch. You're going to feel a touch. And so then I put one finger in, and then I put the other finger in, and I let her know that she's probably going to feel some pressure. And so then as I go in, then I look for where that baby's head is, and there's my baby's head. And then I feel for that cervix. And so with this baby, because mom is so far into labor, then it's actually just going to be right there. But sometimes it's posterior, so then you have to kind of go around, and that's when the mom feels the most pressure, is when you're trying to go around to find that cervix. So I found the cervix on this mom, and I've checked for dilation and effacement. And I'll show you on my hand in just a minute how I know what is what. And this mom she's 90% effaced, and she is 2 and 8. And then I also check where the baby station is, and my indicator of where the baby's head is I feel for the ischial spines. And so I'll go in and I'll find the head, and then I'll go to the side, and if I feel that right where at the same level that the head is, then I know that that's a 0. And then as Gina has said, I have found to be true with my clients too, is that when I do that vaginal exam, if when I go in, then I hit a baby, then that baby is in the plus. That baby has moved down considerably. And so after I have found the dilation and the effacement and where the station is, then I also feel for the sutures. So oops, sorry, that's tipping over. I don't know if you can see, but this baby actually has some really good suture lines. And so I can tell with this baby, so I feel for that diamond, and on one side of that diamond it's going to be longer, and I know that longer part is going to be the front of the face. And so this baby is facing towards the mom's right hip right now, and so it's an ROT position at a station +1 and a dilation of 8 with an effacement of 90. And so once I'm done with my vaginal exam, then I let the client know that I'm going to be coming out now, so that they're prepared for it. And I bring my fingers out, and I let them know what it is. And so for me, then as far as effacement, then I know that on my middle finger, that 2 knuckles is 4 centimeters, so that's going to be 0%. And so 1 knuckle is going to be 50%. And then as far as dilation, I know that with 1 finger, then that's going to be 1 centimeter, and then 2 centimeters is going to be 3. And then a little bit more is 4, and then 5, and then 6. And I know if my fingers are spread all the way apart like this, when I'm in there, if it's like this, then that's an 8. And so if I have to turn my fingers in order to reach it, I know that that mom is more of an 8, and then I can determine a little bit more, you know, like, so here's a 9, here's a 10. So it's, and also if I'm not quite sure where the mom is, then I will just put into memory how my fingers felt, and then I will pull out my tape measure, and I'll measure it based on that, just of my memory of what it was. And so that is how you do a vaginal exam.